Hi, I'm Dr. Farah Ingle, Senior Consultant Physician, Diabetologist, and Director, Internal Medicine, Fortis Hiranandani Hospital, Vashi, Navi Mumbai. Today, I would be talking on adult immunization. Adult immunization is different from pediatric immunization in the sense that pediatric immunization is a national immunization program where you have to take all those vaccines compulsorily to prevent the children or other healthy adults or even healthy persons from getting infected. And if at all you get infected, you have less complications. For we all know that vaccines helps prevent infections, but not 100%. But if you get infected after taking vaccine, it may not be such a serious problem. So in adults, it depends on their previous immunization status. For example, if the patients had been immunized in children during their childhood, then they may not require all the vaccines or they may require some booster doses. And also, the adult immunization varies from region to region, and also it depends on the comorbidities the adult has. So there are certain vaccines which are recommended for all healthy adults, and those to name a few are: one is the influenza vaccine, then we have pneumococcal vaccine, we have the diphtheria, pertussis, and tetanus vaccine, we have MMR vaccine, and we have shingles vaccine. This is to name a few. And certain vaccines which are recommended for high risk individuals or adults are hepatitis A, hepatitis B, meningococcal vaccine, then we have cholera, we have typhoid vaccine, and we have about diphtheria vaccine and rabies vaccines, to name a few. So, going to the influenza vaccine, we have the influenza vaccine available, which will give you cover against four viruses. Influenza, being a vaccine against the virus, has to be taken every year. And every year you have to take an updated version of the vaccine because viruses undergoes mutation. So whatever vaccine was available the year before may not give you protection this year. So go for upgraded vaccine, and the best time to take the influenza vaccine is about October, November, because in winter is the peak season for viral illnesses. It is recommended for all healthy adults above 50 years of age, and also in case if a patient is young but a lady who is going to get pregnant, or those who are immunocompromised or who have comorbidities, then we recommend influenza vaccine once a year. Then we go for the pneumococcal vaccine. Now, pneumococcal vaccine also is recommended for healthy adults above age of 65 years, and also for those adults who are less than 65 years but they have comorbidities, like if you are diabetic, hypertensive, if you have chronic kidney diseases, if you have chronic obstructive pulmonary disease, that is COPD, or you have cirrhosis of liver, you are suffering from cancers, you are on chemotherapy, radiotherapy, if you are immunocompromised, or if you are on steroid therapy, then it is better that you should take this pneumococcal vaccine, which will prevent against pneumonias caused by pneumococci. Now, there are two types of pneumococcal vaccines available. One is the polysaccharide one, and the other is the conjugated one. Polysaccharide and conjugated vaccines in India are available by the name of Pneumovac 23 and Prevenar 13. Previously, the recommendations was to go for Prevenar 13 and then go for the Pneumovac 23 with a gap of at least 8 weeks or to maximum of 6 to 12 months. But the latest recommendations is you can take either of it. Either go for Prevenar 13 first and then followed by Pneumovac 23 with a gap of 1 year, or it could be vice versa. That is either first Pneumovac 23 and then Prevenar 13, again with a gap of 1 year. And then we have the diphtheria, pertussis, tetanus vaccine, that is DPT. Now, if an adult has been immunized by this vaccine during childhood, then you may just take a DT booster. Every 10 years, you are supposed to take this till the age of 65 years. Then we have the zoster vaccine, which we recommend for even healthy adults more than 60 years of age to prevent from herpes zoster infection. And then we have the MMR vaccine, but if you have been immunized in childhood, then we'd avoid it unless absolutely necessary in some cases where we consider revaccination. Then going to those vaccines which are recommended for high risk individuals, we have the hepatitis B vaccine. Now, hepatitis B vaccine also we have now included in the immunization schedule for children as well. So that is at 3 doses, 0, 1, and 6 months. So if the adult has already been immunized and if the adult is immunocompetent, do not have any comorbidities, then you may not take the booster dose. But if you are immunodeficient, if you have comorbidities, or you are at high risk means those who are treating or handling hepatitis B positive patients, like medical workers, paramedical workers who come in contact with hepatitis B patients, and there is a risk of transmission either through needle prick, then OT workers, surgeons who are operating, then even sex workers, then those who are partners for hepatitis B positive patients, because hepatitis B is transmitted through parental route, either through IV or sexual transmission. So those who are at risk, then you can give them boosters or you can check the antibody levels. If the antibody levels are more than 10, then they are adequately protected. You may not immunize. If it is less than 10, then you have to give a booster. The dose for children is 10 microgram, but the dose for adults is 20. And you can recheck the antibody levels later. If it is still not adequate, then you may have to give a higher dose of 40 to an adult. Now, hepatitis A vaccine, there is a live hepatitis A vaccine also available these days. That is also not a routine vaccine. But again, if you are at risk, you are traveling, you are exposed, there is an epidemic, then you may go for hepatitis A vaccine. Usually, hepatitis A is common in children. And if you have been immunized in childhood, there's no need to take that in adults. Then we have the other vaccine like the cholera vaccine, the typhoid vaccine, which normally we give during the type of epidemics and at the season, during the seasonal times. So you have to give these vaccines at least 2 weeks in advance to give the protection, and the boosters have to be repeated from time to time. So typhoid vaccine is available in the oral capsule form as well as the sachet form, which you have to take on alternate days for 3 doses and then repeat every 3 years. So this is for typhoid. Similarly for cholera. And then we have the rabies vaccine. Rabies vaccine, you can give it both ways. One is the pre-exposure vaccine and second is the post-exposure vaccine. Now, pre-exposure vaccine is for those who are handling the animals, like forest officers who are taking care of the animals, or those who are in the laboratory handling the viruses. Then in those patients, in those people, you have to give 3 doses of the rabies vaccine as a pre-exposure vaccination. And if it is the post-exposure vaccination, meaning you have been bitten by a stray dog, which is, we don't know the immunization status, stray dogs usually are not vaccinated. So you have to give 5 doses of the rabies vaccine, which is available as either Rabipur, Verorab, or whatever. And along with that, even immunoglobulin have to be given at the time of bite. The earlier you give, the better it is. It has to be locally infiltrated, half of it, and half of it has to be given at a distant area, about intramuscular, along with the vaccine. If the immunoglobulin is not available, we can even give double dose of the first dose of rabies vaccine. So these are different vaccines available. And meningococcal vaccine also is not routinely recommended, but if you are traveling to a high endemic area, then your doctor may recommend giving meningococcal vaccine. So basically, vaccines helps to protect you from those diseases. And if at all, after taking the vaccine, if you still get the illness, it may not be that serious. So whatever vaccines are available for adult immunization, please go for it and protect yourself from getting infected. Thank you so much.